When someone decides to wear braces, the main goal is always to improve the smile, correct the bite, and align the teeth for long-term oral health. But what many people don't realize at first is that braces demand a much higher level of daily care than natural teeth alone. When brackets, wires, and elastic ties are placed on the teeth, they create new surfaces where food, sugar, and bacteria can easily get trapped. This makes cleaning more difficult and increases the chances of problems such as cavities, swollen gums, bad breath, enamel stains, and in severe situations, even loose teeth or tooth loss. The good news is that these complications are almost always preventable with proper care and attention once the braces are placed. The first thing that happens is a change in how you clean your mouth. Many people underestimate this and continue brushing the same way they did before, which quickly becomes a problem. Plaque begins to accumulate around the brackets, especially near the gum line. If this plaque stays in place, it turns acidic, attacking the enamel and creating the ideal environment for cavities to form. Even people who have never had a cavity in their life may suddenly develop several if they do not adjust their cleaning habits. Another risk comes from forgetting that braces slow down the natural cleaning process of saliva. Normally, saliva washes away small food particles and neutralizes acid throughout the day. But with braces, bits of food cling more tightly to the teeth and don't wash away as easily. This means bacteria have more time to multiply, especially in the hidden corners created by wires and brackets. If left untreated, this can lead not only to cavities but also to gum inflammation. Gums may become swollen, red, or sensitive, and sometimes may even begin to pull away from the teeth, exposing more of the root. If this continues for too long, the bones supporting the teeth can weaken, leading to tooth mobility. The risk of tooth loss during orthodontic treatment doesn't come from the braces themselves, but from neglect. When plaque sits around the gum line for long periods, it can cause an infection known as periodontal disease in the early stage. The condition is mild and reversible, but if ignored, the damage can progress deeply into the bone. When bone support is lost, the teeth no longer sit firmly in place. Combined with the gentle pressure of braces, teeth can shift in unhealthy ways or become loose. This is why consistent oral hygiene is not optional for anyone wearing braces. It is essential. One of the most important steps is learning to brush correctly. Brushing with braces must be thorough and slow. Each bracket needs to be cleaned from above, from below, and around the sides. The toothbrush should be angled so that the bristles reach underneath the wires. A lot of people brush quickly, thinking that speed is enough, but braces require patience. Spending at least 2 minutes brushing is recommended, although 3 minutes is even better for orthodontic patients. Using a soft bristled brush or an electric toothbrush helps clean more effectively without damaging the enamel or irritating the gums. Along with brushing, flossing becomes absolutely necessary. Regular floss can be difficult to maneuver between wires, but floss threaders or orthodontic flossers make the process easier. Skipping flossing is one of the biggest reasons orthodontic patients develop gum problems. Even the best brushing technique cannot remove the plaque that hides between the teeth. That hidden plaque sits untouched, producing acid day and night, slowly damaging the enamel and irritating the gums. Flossing once a day is essential, but many orthodontists recommend doing it at night when plaque has accumulated from meals throughout the day. Another helpful tool is an interdental brush, sometimes called a proxy brush. These small cone-shaped brushes can reach under the wires and around the brackets in ways a regular toothbrush cannot. Using one of these after meals helps remove pieces of food that get caught in the braces. This alone can reduce the risk of cavities significantly. Diet also plays a major role in preventing oral problems when wearing braces. Sticky foods, sugary snacks, and soft drinks, it can quickly cause trouble. Sugar feeds bacteria, and bacteria produce acid, which weakens the enamel. Soft drinks, even diet ones, are acidic enough to harm the teeth on their own. When sugary or acidic liquids seep under the brackets, they can cause white spots to form on the enamel. These spots are early signs of demineralization, meaning the enamel is being eaten away. Once they appear, they are very difficult to remove. For some people, the white spots remain permanently, even after the braces come off. Hard foods can be dangerous too. Biting into crunchy foods like popcorn kernels, nuts, or ice can break brackets or bend wires. When wires bend or brackets come loose, the teeth may move in the wrong direction or stop moving altogether. This can extend orthodontic treatment and create more opportunities for plaque to accumulate in places that are difficult to reach. Regular dental checkups and cleanings are essential during orthodontic treatment. Seeing the dentist every 6 months or more often if recommended allows early detection of cavities or gum inflammation. Professional cleanings remove hardened plaque that brushing alone cannot remove. Many orthodontic patients benefit from using fluoride mouthwash or fluoride treatments at the dental office to strengthen the enamel and reduce the risk of decay. Another important habit is paying attention to early warning signs. If the gums bleed frequently, this is usually a sign of inflammation, not a sign to stop brushing. If brushing or flossing causes bleeding, it generally means more cleaning is needed, not less. Persistent bad breath is also a sign that bacteria are thriving somewhere around the braces. Sensitivity to hot or cold may indicate enamel erosion or early stages of decay. Addressing these issues early prevents them from turning into something more severe. Finally, discipline is the key factor. Braces are a long-term commitment. For many people, treatment lasts 1 to 3 years. During this time, brushing thoroughly, flossing daily, cleaning around brackets, watching the diet, and visiting the dentist must become part of the routine. It takes effort, but the results are worth it. When someone finishes orthodontic treatment with teeth that are not only straight, but also healthy and strong, the smile is truly transformed. If someone ignores the necessary care, the consequences can last a lifetime. Cavities may require fillings, root canals, or crowns. Gum disease may cause irreversible bone loss. Teeth may become loose or shift in ways that damage the bite, but none of this needs to happen with consistent care and proper daily habits. Braces can give excellent results while keeping the teeth and gums safe. If you wear braces, listen closely. What you're about to hear can determine whether you finish your orthodontic treatment with a perfect smile or with permanent damage to your teeth. Most people don't realize how easy it is to ruin their braces and harm their teeth without even noticing. Small habits, when repeated every day, can destroy months of progress. So today you'll learn the essential care that everyone with braces needs to follow to protect their teeth and avoid expensive problems in the future. One of the biggest mistakes people make is not cleaning their teeth properly. Braces trap food, sugar, and plaque all day long. And if you don't remove them, bacteria start attacking your enamel immediately. You must brush after every meal, not just twice a day. Use a soft toothbrush so you don't damage the brackets. And always brush at 45-degree angle so the bristles reach the gums and the edges around the brackets. An interdental brush is one of your best friends. It slips under the wires and removes what regular brushing can't. If you ignore this step, you might not notice the damage right away, but slowly stains will appear around the brackets. Cavities can form underneath, and your gums will swell and bleed. That inflammation can even slow down tooth movement, meaning your treatment takes longer and becomes more painful. Proper cleaning isn't optional, it's essential. Another critical part of protecting your teeth is avoiding the wrong foods. Sticky foods like caramel, chewing gum, taffy, and gummy candies can get caught in the wires and pull the brackets. Hard foods such as popcorn kernels, nuts, ice, and hard candies can break the brackets or bend the wire instantly. Even seemingly harmless foods like apples or carrots can cause damage if you bite directly into them. If you must eat them, always cut them into small pieces and chew carefully. When a bracket breaks, most people think it's not a big deal, but every broken bracket delays your treatment. It can shift your teeth in the wrong direction, and the orthodontist has to undo that mistake before continuing. That can add weeks or even months to your treatment. Another thing many people ignore is flossing. Yes, it's annoying with braces, but skipping it is a huge mistake. Flossing removes the bacteria that sit between your teeth, places your brush simply doesn't reach. You can use orthodontic floss threaders, special floss with built-in stiff ends, or even a water flosser if you want something easier. If you skip flossing, plaque hardens into tartar, and that leads to gum recession and cavities that may not show up until your braces come off. Mouthwash is also important. A fluoride mouthwash protects the enamel and helps prevent white spot, those chalky marks that appear around brackets when plaque it stays in one place too long. Once you get those white spots, they are permanent marks on your teeth. Prevention is the only solution.